Dr. Weiss from Norterra Family Medicine. It is July and it is hot, so we are talking today about excessive sweating. So the medical term for excessive sweating is hyperhidrosis, and not everyone has a diagnosis of hyperhidrosis that might be upset or embarrassed about excessive sweating. So I know a lot of us who have to do presentations, myself included, who might have to get up on podiums and talk or are in a sales position. I hear a lot about people with concerns about sweating. So, and in Arizona, Phoenix, of course, it's extra hot, and this can be a real problem, especially if you're driving around your car and then you have to arrive for work somewhere and look presentable. So I wanted to introduce you all to a new solution to excessive sweating, which is called Brella. This is something that's available at our sister practice, Paradise Med Spa and Wellness, which is right next to our office. This is amazing. This is new technology where we apply a patch. It's just a small patch about the size of your armpit under each arm, and it uses a chemical reaction. It's a sodium patch. So that sodium mixes with the water in your sweat to create a thermal reaction that downregulates the sweat gland activity. So this treatment only takes 3 minutes per side. So you're talking, 6 to 10 minutes for the whole procedure, start to finish, and lasts 3 to 4 months, sometimes longer in certain patients. The results are really impressive. If you have a diagnosis of hyperhidrosis, if you are a significant sweater, you may notice 50% reduction. And most people with hyperhidrosis are happy with 50% reduction. Now, if you are just a patient that might be concerned about sweating in social situations, or like I said, with work, during presentations and things like that, and you don't have a diagnosis of hyperhidrosis, then you should expect even higher response rate. So we're seeing 80-90% response rate. There are other treatments that I should mention, Botox injections being one of them, and that's something that we do offer. The insurance coverage with Botox injections is hard to come by. Most of my patients struggle with that, but it is an option. The nice thing about Brella, of course, is there's no injections. With Botox, you have to get injected. Brella treatment, like I said, lasts 3 to 4 months. Botox lasts about 6. It is more expensive when you're paying out of pocket, so keep that in mind. A Brella treatment should run you around $450, where a Botox treatment could run you about $1,000. And you're doing that twice a year. So the Brella I do find to be more cost effective. There is another solution that's called Dry that you might have heard of. Dry is a device that uses microwave energy again, it's a thermal reaction that downregulates the sweat glands permanently. So that is a device that you'll see out there. We don't have that device available. There is more risk to that treatment, but again, the upside is that it's a permanent result. Treatment cost for that runs $2,000 to $3,000, so it is a little bit more pricey, but you're going to get that longevity out of your treatment. Risks for that can include nerve injury. There's the brachial plexus, which is a very important set of nerves that sits under your armpit, that you don't want cooked with microwave energy. So I think that they have perfected the protocols with that device. We did see a patient that when that device initially came out had a brachial plexus injury, and those things can be permanent. So I've been a little gun shy about bringing that treatment on. But again, Brella, super easy, something that we can do in the office very quickly. The other thing to note is that there are a lot of patients, and I think a lot of our patients here at Norterra Family Medicine, because we do have a focus on integrative medicine and holistic health, a lot of our patients are avoiding things like aluminum that is found in antiperspirants because of its potential, though not proven, increased risk for breast cancer. So that's something to think about as well. So if you're using deodorant and not antiperspirant, and you're finding like Tom's or some of those other brands that are just deodorant, and you're not finding it to be as effective, especially over the summer months, you might want to consider something like Brella, at least maybe doing that, to get you through the summer. So that's something to consider as well. There are oral medications, there are other topical medications that we can prescribe There is something called glycopyrrolate, which I have used off-label for excessive sweating. And I think that is something I choose for the patient that sweats everywhere. They're sweating on their head, they're sweating on their back, they're sweating under their arms and their hands. And a patch that's just applied under the arm isn't going to be really that effective as a solution. So glycopyrrolate is an option, but you should know, again, with anything that's systemic, when you're taking it by mouth, there's going to be systemic side effects such as dry mouth, but it is fairly well tolerated. The other thing is the dry sol. Dry sol is like a prescription strength deodorant, or not deodorant, antiperspirant, and that is aluminum based and is very strong and can dry out the underarm area to the point where I have patients that don't love it. So, but it is an option, and some insurance requires you to have tried some of these other things before they would cover something like Botox. Brella at this point is not covered by insurance at all, but it is a little bit more affordable. So something to think about. If you have questions about excessive sweating and are looking into treatments for yourself, please give us a call at 623-565-5060. See ya.